5 dangerous side effects of amlodipine that seniors must never ignore. What if the most commonly prescribed blood pressure medication in the United States could silently trigger a life-threatening event? That little pill you or your loved one takes every day might be doing more than just lowering blood pressure. In the next few minutes, we'll explore 5 extremely dangerous side effects of amlodipine that often go unnoticed until it's too late. Just one of these side effects alone sends thousands of users to the emergency room every year. You've probably heard about common side effects like ankle swelling or dizziness, but this video is completely different. We're exposing life or death warnings your body might be sending you right now. Red flags, signaling a serious medical emergency. Before we begin, if you haven't subscribed, hit that subscribe button and notification bell. The information I'm about to share could save your life or the life of an elderly loved one in your family. Here are the 5 dangerous side effects of amlodipine you must never ignore. Please note, this video is for informational purposes only and does not replace medical advice from your doctor. All information is research from trusted sources: NIH, American Heart Association, Mayo Clinic, and peer-reviewed medical journals. Side effect 1. Pulmonary edema. High risk of death. Let's start with the first and most serious side effect: pulmonary edema. To help you visualize this, imagine our lungs like an extremely sophisticated sponge. Normally, this sponge has millions of tiny holes that allow air to flow in and out easily. That's exactly how we breathe and exchange oxygen to live. But when pulmonary edema occurs, what happens is terrifying. This sponge starts getting soaked with fluid, specifically fluid from the blood. When these tiny holes fill with fluid, air has a very difficult time getting in and out. The result is you'll feel like someone is squeezing your throat tight. Why would amlodipine cause this deadly condition? As a calcium channel blocker, it relaxes blood vessels to lower blood pressure. But in people with weak hearts, when lung blood vessels become overly relaxed, pressure drops sharply. This causes fluid to seep into the air sacs, where oxygen should pass through. The symptoms you need to watch for immediately include severe shortness of breath, not the normal kind, after exercise. This is the type where you feel like a heavy rock is pressing on your chest. Especially, this condition becomes much worse when you try to lie down. The reason is that when lying flat, fluid distributes more evenly throughout the entire lung. You'll hear abnormal and frightening sounds when breathing: wheezing, crackling, or gurgling sounds like water boiling inside your chest. Some people describe it like a coffee machine running inside their rib cage. Persistent coughing is also a warning sign. And what's scary is you might cough up pink-colored sputum or white foam. This isn't a sign of a common cold. It's fluid from the lungs mixed with blood from damaged tiny capillaries. Finally, you may feel unusually anxious or panicked, even if you're normally a calm person. This isn't a psychological symptom. It's your brain's alarm bell when it's not receiving enough oxygen to function normally. I want to emphasize this in the most serious way possible. Pulmonary edema is an absolute medical emergency. If you have any of the symptoms I just described, especially shortness of breath with pink-colored sputum, call 911 immediately. Don't try to drive yourself to the hospital. Don't wait to see if it gets better. And don't think a nap will make everything better. Every minute of delay could be the difference between life and death. Side effect 2. Heart arrhythmias. When your heart loses control. The second side effect we need to discuss can be equally dangerous: heart arrhythmias. To understand why this is so dangerous, we first need to understand how a normal heart works. I often compare the heart to a perfect symphony orchestra. There's a conductor, the sinoatrial node, directing each beat with precision. Normally, this orchestra plays at a steady rhythm of 60 to 100 beats per minute, when you're at rest. But when amlodipine interferes with the heart's electrical system, this conductor can become confused. The result is the orchestra starts playing chaotically. Sometimes too fast, like crazy rock music, sometimes too slow, like funeral music, or completely out of rhythm, like a child randomly banging drums. Why can amlodipine disrupt this system? Calcium is crucial for heart's electrical signals. When amlodipine blocks calcium, it doesn't just relax blood vessels, but can disrupt the heart's electrical system, especially in people with existing heart problems. The symptoms you might feel are very diverse and concerning. The most common symptom is feeling your heart pounding or beating so hard you can hear your heartbeat in your ears. Many patients describe it like their heart is about to jump out of their chest, or like someone is continuously punching their chest from the inside. You might also have a very strange sensation like your heart skips a beat, or like a beat goes missing. This is usually due to abnormal beats interspersed with the normal beats, creating the sensation your heart is hiccuping. When the heart doesn't beat regularly, it can't pump blood effectively like a broken pump. This leads to the brain not receiving enough blood, causing dizziness, lightheadedness, or feeling like you're about to faint. Some people may actually faint if the arrhythmia is severe enough. Chest pain or discomfort in the heart area is also very common, especially if the heart beats too fast. When the heart has to work overtime at an abnormal pace, the heart muscle can become oxygen deprived and painful. Unusual fatigue is also an important sign. When the heart isn't working efficiently, the entire body doesn't receive enough blood and oxygen needed. You might feel exhausted, even doing simple tasks. What's most concerning is that some arrhythmias can progress to more dangerous conditions. Atrial fibrillation can lead to stroke due to blood clot formation. Ventricular tachycardia can lead to cardiac arrest. This isn't to scare you, but to help you understand the importance of monitoring. When should you seek immediate medical attention? If you feel abnormal heart rhythms along with severe dizziness, chest pain, or shortness of breath, this could be a sign of dangerous arrhythmia, and you need to get to the hospital immediately. However, even if symptoms seem mild, you should still keep detailed records. Timing, duration, severity, and what you were doing when symptoms occurred. This information will be extremely helpful when your doctor evaluates your condition. Side effect. 3. Heart failure, when your life pump weakens. Now we come to the third side effect, heart failure. I want to start by dispelling a dangerous misconception that almost everyone has. When hearing heart failure, 99% of people immediately think of the heart stopping completely. This is completely wrong and dangerous. Heart failure doesn't mean your heart stops working. Instead, it means your heart is gradually losing its ability to pump blood as efficiently as it once could. Imagine you have a water pump that's been used for 20 years. The pump still runs, still makes noise, but its efficiency has significantly decreased. Instead of pumping 100 gallons per minute like when new, now it only pumps 60-70 gallons. Water still flows, but not strong enough to reach the far corners of the garden. That's exactly what happens to the heart when it fails. The heart still beats, but each contraction isn't strong enough to push the necessary amount of blood throughout the body. The paradox: amlodipine often treats heart failure, but in people with already weak hearts or valve problems, it can worsen the condition. The heart needs certain pressure to pump effectively. When amlodipine reduces pressure too much in weak hearts, it's like asking someone elderly to lift heavy weights with tired arms. Heart failure symptoms usually develop gradually, causing many people to ignore them or blame aging. The first and most common symptom is unusual fatigue. This isn't normal tiredness after a long workday. This is deep, heavy fatigue that makes you feel exhausted, even doing simple things like walking from room to room, or even just standing up from a chair. Shortness of breath, especially with exertion, is very characteristic. You might notice that activities you previously did easily, like climbing stairs, carrying grocery bags, or walking a short distance, now leave you breathless, like you just ran a marathon. A particularly worrying sign is shortness of breath when lying down. Many people have to sleep with 2 to 3 pillows to keep their head elevated, or even sleep in a chair instead of bed. The reason is that when lying flat, blood from the legs and abdomen returns to the heart more, which the weak heart can't handle, leading to congestion in the lungs. Swelling is a very characteristic and easily recognizable symptom. It usually starts in the feet and ankles, especially noticeable at the end of the day. When you press your finger into the swollen area, there will be an indentation that lasts several seconds before the skin bounces back. Swelling can progress upward, calves, thighs, and even abdomen, making you feel unusually bloated. Sudden weight gain is a warning sign many people overlook. If you gain 2 to 3 pounds in 1 to 2 days without obvious reason, like eating more, this could be a sign your body is retaining water due to inefficient heart pumping. Coughing, especially nighttime cough, or coughing up white foamy sputum, can also be a symptom of heart failure. This occurs due to mild congestion in the lungs. The most important thing to remember is that heart failure isn't a death sentence. This is a completely manageable condition if detected and treated promptly. Many people with heart failure still live normal lives with good quality of life. If you notice these symptoms worsening over time, or multiple symptoms appearing together, this isn't the time to wait. Schedule an appointment with a cardiologist as soon as possible. Side effect. 4. Worsening chest pain. A frightening paradox. The fourth side effect sounds like a medical paradox. Worsening chest pain. Why would a drug designed to help the heart potentially increase heart pain? First, we need to understand what chest pain really is. Chest pain, or angina, occurs when the heart muscle doesn't receive enough oxygen-rich blood. Imagine you're exercising and tighten a rubber band around your arm. After a while, the muscle will start hurting and cramping due to lack of blood. That's exactly what happens to the heart muscle when deprived of oxygen. Now, here's the paradox. Amlodipine is often prescribed to treat chest pain, and in most cases, it's actually effective. But in some people, especially during the first few weeks of treatment, this drug can temporarily make the condition worse through a mechanism called coronary steal syndrome. When amlodipine works, it dilates all blood vessels, but healthy vessels dilate more than damaged ones. Blood flows more through healthy vessels and less through narrowed ones, making already oxygen-deprived heart areas even worse, at least initially. Recognizing chest pain is very important because many people, especially women, don't experience the classic chest pain that people usually think of. Typical chest pain is usually described as feeling heavy, tight, or pressure in the center of the chest. Many patients say it's like having an elephant sitting on their chest, but pain can manifest in many other ways. It can radiate to the left arm. This is the most famous symptom, but can also radiate to the right arm, both shoulders, neck, jaw, or even back. Some people only feel pain in the jaw or neck without any chest pain at all. Chest pain is usually triggered by predictable factors: physical activity, emotional stress, cold weather, or eating a large meal. What's characteristic is that the pain usually subsides when you rest within 5-10 minutes. But here's when you need to worry seriously. If your chest pain starts becoming more frequent, more severe, or lasting longer than usual after starting amlodipine, this is a red flag signal. If chest pain starts occurring even when you're resting, sitting watching TV, lying in bed, or wakes you up at night, this is a sign of a very serious condition. Any chest pain lasting longer than 15-20 minutes and not relieving with rest should be considered an absolute medical emergency. This could be a sign of an ongoing heart attack. Side effect 5. Dangerous dizziness. When to worry. The final side effect we need to discuss is dizziness, a symptom many people dismiss, but can be a warning sign of more serious problems. Dizziness from amlodipine isn't like normal dizziness when you spin around or stand up too quickly. This is the type of dizziness that can signal your blood pressure is dropping to dangerous levels. The main purpose of amlodipine is to lower blood pressure, and this is usually good. But in some people, especially the elderly or those taking multiple different medications, amlodipine can lower blood pressure too much below what the body needs to function normally. When blood pressure drops too low, the brain, the most important organ that needs the most oxygen in the body, may not receive enough blood to function optimally. The result is dizziness episodes that can be very dangerous. What's particularly dangerous is orthostatic hypotension, when blood pressure drops suddenly when changing positions. Amlodipine can weaken the body's automatic blood pressure adjustment mechanisms. There are different types of dizziness you need to distinguish. Light dizziness is a feeling of unsteadiness, like walking on a boat in gentle waves. You feel unbalanced but can still stand steady. Severe lightheadedness is more serious. This is feeling like you're about to faint, often accompanied by blurred vision, seeing bright spots, or feeling like someone is pulling your vision into a dark tunnel. Complete loss of balance is the most dangerous level. You feel unable to control your body, which can lead to falls and serious injuries. For prevention and management, there are several important measures to remember. Always change positions slowly. When sitting up from bed, sit on the edge of the bed for 30 seconds to let your body adjust before standing. When standing from a chair, stand slowly and hold on to something for support. Drinking enough water is very important, especially in hot weather or when you're sick. Dehydration can increase the risk of low blood pressure. Avoid standing in one place for long periods, especially in hot weather. If you must stand long, move your legs to help blood circulation. If you feel dizzy at any time, sit or lie down immediately. Don't try to fight it, because this can lead to falls. When should you worry seriously? If dizziness is accompanied by chest pain, shortness of breath, or heart palpitations, this could be a sign of serious cardiovascular problems. If you actually faint, even for just a few seconds, this is a condition requiring immediate medical evaluation. So we've explored 5 dangerous side effects of amlodipine you may never have heard about. Remember that knowledge is power. Most importantly, never stop taking amlodipine suddenly without consulting your doctor. Stopping blood pressure medication abruptly can cause dangerous spikes leading to stroke or heart attack. Become the person who knows your body best. If you feel anything unusual after starting amlodipine, tell your doctor immediately. Call 911 immediately for coughing up blood or pink foamy sputum, severe chest pain lasting over 15 minutes, severe shortness of breath, especially unable to lie flat, fainting with chest pain or shortness of breath, abnormal heart rhythms with severe chest pain. Call your doctor within 24 hours for new or worsening leg, ankle swelling, unusual fatigue lasting days, severe or frequent dizziness, concerning heart rhythm changes. Create a symptom diary. Monitor blood pressure at home. Maintain healthy lifestyle habits and always carry your medication list. Finally, I want to remind you that amlodipine remains a very effective and safe medication for most people. Millions of people worldwide use it daily without any problems. The purpose of this video isn't to frighten you, but to equip you with the knowledge necessary to use the medication in the safest and smartest way possible. If this video has provided you with useful information, please like and share with loved ones who might be using amlodipine. This knowledge could save their lives. Don't forget to subscribe to the channel and hit the notification bell so you don't miss other important health videos. In next week's video, we'll discuss how amlodipine interacts with other medications that seniors commonly take, an equally important topic. Thank you for taking the time to listen. Always take care of yourself, listen to your body, and remember that having health knowledge will help you live longer, healthier, and happier lives. See you in the next video.